At the moment, I think there's a big dilemma for many of us around what jobs are going to continue in the future, which sort of brings me on to some of the current themes around AI. And I know you're quite passionate about this as well. I heard there's a few countries doing kind of these tests at the moment where they're comparing doctors versus AI and who's managed to come up with the most accurate diagnosis in the most quickest speed. From that perspective, are you afraid for your profession? And what's your opinion on AI? Where's it going to go?
I'm going to say the same as everyone else. It's huge potential, possible danger. And I think the opportunity is certainly bigger than the threat in probably working life practice. But you're right. Doctors, and certainly in my lifetime, you won't see surgeons going anywhere. We may do what we do differently, but there's nothing anywhere near on the horizon good enough to deal with the variations in human anatomy and the handling and the skills, the conceptual skills, what needs to be done in a controlled operation, but uncontrolled operation, which is often the case in trauma. We've tried to do simulation training. We've even tried to do computer-based training, virtual training. We just do not have the visuals or the haptics yet to replace bodies. We still train. We have to train, particularly in trauma, in that hot decision-making environment where you've got to get in there, your hands get dirty, you've got to actually do something to somebody to fix them immediately. That really can't be trained on anything else. I'm a big fan because of the data side. We know so much. We collect billions and billions of data points on patients. And yet the NHS doesn't have a clever way of analyzing this. And the NHS doesn't have systems that talk to each other. It's crazy. We're not really a national health service, certainly from an infrastructure perspective. We don't share data anywhere near as well as we should. But if we analyze large bits of data, we've got it all now. I mean, if you think about it, if you had a sore hip from arthritis and I'd done an X-ray and knew you had arthritis, we've already got the technology. You're probably wearing a watch on your hand that measures your heart rate, your steps, how long it took you to walk those steps. So already this thing is already judging your fitness, your cadence, your walking rhythm, what your heart rate goes at, how fit you are, etc. And then we know you've got arthritis of the hip. We know how old you are. We've got millions of data points in the UK and around the world of people who have had joint replacements or like a hip replacement before. We could literally be in a position, and the tech that could put us there is already in existence. It's a pipe dream in the future. It's just the algorithm we have to get right, software side of it. And that's something that we feed in. But we already have the tech that if a patient comes to me for a hip replacement, as they walk into the clinic, they walk over a force meter and a walking plate, we can have a 3D or 4D camera, which we already have, which assesses your gait as you walk. And on top of that, I've got all your wearable tech information. When you walk into clinic, I just need to look at that X-ray and say, the computer's already done all your maths. We know what you weigh. We know your fitness levels. We know how you walk. We know your gait pattern. We know your age, your Asian, your bone quality, et cetera, based on all of these AI parameters and machine learning that we've gathered. This is the hip replacement you're going to have, and this is the outcome you're likely to have. And the computer says, go ahead and we'll do this for you in 3 weeks. It's that tech already exists where it will tell you specifically what your problem is compared to the other person, what the best solution may be. That's just looking at one aspect of orthopedics.